Thank you, Lauren, and good afternoon, everybody. My name is Trav Robertson. I'm chairman of the South Carolina Democratic Party, and welcome to Talking with Trav, a new series that I have been forced into by our communications team. But we are excited to be here this afternoon with two candidates who are running for the South Carolina State Senate, Dr. Debbie Bryant, from down in towards Berkeley County, and then Dr. Dawn Bingham from up towards Spartanburg, South Carolina. Two very different parts of the states, and the fact is that this is going to be a series highlighting our local candidates. Everyone knows that I love local races. I think that it is truly the backbone of our democracy, and sometimes we don't take time to focus on those. And the truth is that if we win the state senate, we can help redistrict this state so we've got fairer lines and fair districts. It helps with education policy, but most important, we only have 4 women in the South Carolina State Senate, and we have 2 individuals who will help us shape the healthcare policy, which really leads us why we're here today. I mean, we're going to work very hard to get them elected, but most importantly, we've got women up and down the ticket. We've got 2 wonderful individuals, highly qualified doctors. And we've got Kim Nelson in the 4th district, Adair Burrows in the 2nd, Melissa Watson running for Congress in the 7th. We've got 2 women running for sheriff in Colleton County and 1 in Charleston. So this is the year in which women are going to have a significant impact on the election cycle in South Carolina. 200,000 more women than men voted in 2018. Almost 1 million women cast ballots in the state. We think that number will go much higher. But with only 4 women in a state where 56% of the registered voters are women in the General Assembly and the Senate, it has to change. And so with that, I'm going to lead off with Dr. Debbie Bryant from down in Berkeley County. Tell us about yourself.
Oh, I would love to. Thank you so much, Trav. I appreciate being with you here today and sharing the stage with my physician colleague. So let me start by saying I'm a nurse. My doctoral training is in nursing practice. So I'm a nurse by trade, a registered nurse, and yoo-hoo for all the nurses out there. So I grew up in local Berkeley County. I grew up in Moncks Corner in a tight unit family down here with lots of support from that unit. I then trained, met my husband and married and left and he's in the military, retired from the military now. So I come from a military household. I have been involved in community and public health nursing for more years than I sometimes want to remember, if you know how that goes.
I do.
So working in vulnerable populations, really having a firsthand look and understanding those individuals who didn't have access to healthcare, to ensure that we were doing the best we can in the state with what we had, but certainly understanding the need to expand and having access to healthcare for everyone. And so then when we were faced with this COVID-19 pandemic, that's what inspired me to really decide that it was time to use my talents and skills in a different way to shed light on the importance of public health and having a great public health infrastructure in the state of South Carolina. So that's why I made that decision to run. You know, Gandhi said, be the change you want to see in the world. So if we want to see change, let's get involved, and here I am. So let's do it.
Thank you, Dr. Bryant. And then Dr. Bingham.
Yeah, thank you, Trav, and thank you for holding this series. What a great idea to introduce everybody to the candidates that we have in South Carolina, because we have some phenomenal people that are running. And I am really pleased to be here with Dr. Debbie Bryant, and I'm really pleased to be on with you today. I'm the Senate candidate for South Carolina District 12 up here in the upstate part of South Carolina, which encompasses a good part of Spartanburg and a chunk of Greenville County. I'm an OBGYN. I've been practicing medicine in South Carolina for over 20 years. I also have a master's in public health and have seen things all all the while I've been practicing medicine through a public health lens. I've been a local and state and community advocate, also on the national level, talking about things like maternal mortality in our state and on the national level, and have been working to make sure that things like Medicaid expansion comes to the forefront. I think that it's really important for people to understand that people in medicine have the lens of public health when they're making decisions about everything, because we know everything comes back to that. Right now, I think people are very much waking up to the fact that public health and the economy are very closely intertwined. They're not separate. They're very intertwined. We need people to be healthy to be out in the workforce. We need to make sure that our economy can keep moving because we have people that are healthy and can work. I think that it's very important for people to recognize that. And I think that medical professionals have realized that all along. And that's one of the reasons that I'm running.
And as those of you listening can hear, we have two very educated individuals who have given their life to public health. And that's something we're very appreciative that you're taking time at this specific juncture in America to run for office. And I'm going to get to a question in just a minute. I just want to make sure everyone knows, Dr. Bingham, your district, Senate District number 12.
That's correct.
And then Dr. Bryant, if I'm not mistaken, your Senate District number 44.
That's
and
correct.
So when those of you are researching these two candidates, you'll have a district. You know, it's interesting that in Senate District 12, 53, almost 54% of the registered voters are women, 45,000, and then almost 23% of the registered voters are non-white, almost 19,000. And then conversely, in Dr. Bryant's district, you've got almost 55% of the registered voters are women, and then almost 31% of the registered voters are people of color. So as you take that into consideration, or you know those numbers, tell us why at this juncture, your medical background, and why at this moment, particularly in the midst of COVID-19, why people should be convinced to elect individuals with your particular background and expertise. Dr. Bingham, if you want to start off.
Yeah.
Softball.
Absolutely. So I think that it's really important recognizing that we have people in medicine and people in the legislature who want to work together. We are coming upon this large crisis in our state. We see how South Carolina has done with the current health outcomes across the board. And we see where we were leading up to the COVID crisis that we have now. And the fact that we had this slashing of our DHEC budget that basically precipitated this crisis for us, we need to make sure that we have people in place that will know how to talk about these things, know how to debate these things, and are willing to have collaborations across the aisle to talk about public health issues. I think that we have a number of problems in our state, including the health outcomes that the COVID has absolutely exposed. And again, as I mentioned previously, it doesn't just come back to the health outcomes. We know that those are serious health outcomes, and we know that people who have lesser access to insurance and lesser access to medicine are experiencing these bad health outcomes as well. But they're also people who are frontline workers and essential workers who may not have the pay equity and are actually experiencing this crisis in a whole other level besides the health outcomes. And so taking that into consideration, I think it's very important that we have medical professionals in the legislature who are helping to make these decisions, because they can really help educate their colleagues and be transparent with the public about the things that are important to them.
Dr. Bryant.
Bravo, Dr. Bingham. So what I will agree with, of course, everything she said, but in addition, public health systems it works in the background. They're invisible unless they go wrong. And then all of a sudden, everybody else kind of understands it, right? Yeah. But for us, we understand what that needs to look like all the time. Yeah. And so you have to have folks at the forefront who are making decisions, who understand what that need is. And I also think that as healthcare professionals, we have always had to understand how to work and ensure that everyone is brought into the fold. We're not working for one side or the other. We're working for the health and well-being of South Carolina. So understanding COVID, understanding that the path to having a great economy means that we get this crisis under control. and we have a structure that can have both of those things work together, I think that that's the voice that we bring that's a little bit different and that we need so desperately in our state house.
So I'm going to ask a weird question, and if I phrase it wrong, but before I do that, it's DebbieForSenate.com is your website, Dr. Bryant, for those of you who want to explore it, and it is DrBingham.com, which is Dr. Bingham's website for those who want to go in and take a gander. This is a weird question, and that is that you've got one foot, both of you've never run for office before. This is the first time. Dr. Bryant likes to have early morning Zoom calls. I don't know how I know that, but so my question is that you're running for office. We're in the middle of a pandemic. You both have expertise in the medical profession. Does it create not just an urge to be successful in your races, but does it also create a level of frustration or anxiety because you know what your education and your background tells us to do, and you maybe don't see what's happening from the government, the legislative, or from the governor's perspective? Dr. Bingham, speak to that point if I'm even off base here.
So if I understand your question correctly, what you're asking about is, can you see both perspectives, both from the clinical, medical, public health side, and can you see what's going on in the government side? And does that frustrate you? Well, on an individual level, when I'm taking care of patients and they come in to see me and they don't have what they need for their health care, yes, that very much frustrates me because I know how much more can be done. I know what can be done in the state of South Carolina. So, for instance, expanding Medicaid that would provide for my patients. I definitely feel frustrated for them and know that they have difficulties getting what they need. But on a larger level, I don't afford myself that luxury to get frustrated. There is work to be done. And I have been doing that work in the state and on the national level in the different organizations that I'm with, like we were talking about earlier, you and I, with maternal mortality, with fixing some of the things with Medicaid, with the Centers for Medicaid systems, and so forth. Those things that work that needs to be done. You have to collaborate across the aisle. You have to collaborate with organizations that you may not work with all the time because those conversations have to be able to happen. So I think that the frustration that you're talking about is really an energy.
Dr. Bryant?
I will agree with that. I think the energy part of it is where I would stand. So the frustration actually pushes you to a sense of urgency.
Right.
We've been doing this work for so long, and I've had the opportunity as well to work with national, state organization, local organization, and we've been saying the same things for so long. So now it's time for us to step up to the plate and show that we can be a part of the system to help govern the changes that we 100% believe it's time for us to make happen. So now there's a sense for urgency, and I hope that urgency translates into vote for both of us so that we can be a part of the State House to really lead and change.
Yeah, absolutely.
You both have many qualities that I do not have, but one of those is if I'm not mistaken, you're both mothers. You're both parents.
Yeah.
And as we are heading into the start of school season, with your medical backgrounds, with school seasons, if you were in the legislature right now, if you were in the Senate, where do you think your direction would be as it relates to working with Molly Spearman or urging Governor McMaster? What course would you propose we take in the middle of this crisis that we're in now? Dr. Bryant, you want to hit that one first, or?
Sure, absolutely. So, one of the things I really wish that I had an opportunity to speak to our governor early into this crisis is to just say, if we would just get every single leader to wear a mask, if we just did that, we wouldn't have to even be talking about mandates and all these other things that people are, concerned about. Let's just lead by example. Let's just sit down and hammer out and understand that the public health recommendations should be at the top of our list. Let's make those things top of the list. And then people would understand and believe that we care about their family as we care about all the things that other things that are going on. I think Dr. Bingham and I are on board with, we want our economy open. We want, because people have a self-worth when they're working and contributing to their family. But we need to share and understand that as leaders, we have to set the right example from the top, and then we can deal with all the other things that are coming in to set this as a priority so that we're offering our state the best opportunity to be successful.
Yes, I would have to agree with you. And I think what you said, Debbie, is very right, that we had a very good beginning in the sense of we had the opportunity to have everybody wearing masks, but we haven't missed that opportunity now. We can start now. We can have everybody wearing masks. We don't have to keep looking backwards, right? We can say, now's the time to keep wearing the mask for sure. I think that people recognize the importance of this and the importance of taking care of each other. And this is how we do that as a community, because by the time somebody comes into the hospital and they're sick, and they talk about people in the hospital being frontline workers, actually the people who are the frontline people is the community taking care of each other first and foremost, because that's the end of the line is once you get sick, right? And so very much so, I think that it's very important to recognize that as people are talking about going back to school, the single most important thing to be thinking about is the health and safety of both our children and understanding the data and what drives any local school organization to do what they're doing, and also the health and safety of the people that are going to be taking care of them. And so I think that there are some innovative solutions that could definitely be worked out. I know that each of the school districts is trying to do that. And I think it is a huge concern, because as a mother thinking about where to send my children for their schooling this upcoming fall, I've got 2 that are in high school and 2 that are in colleges, and they're all 4 in different schools, and all 4 schools are doing something slightly different. And it's nuanced in what's important for each of those communities. And so having people who are willing to talk to each other, and having people who are willing to change their mind when presented with new information about what might be the best thing as far as the safety is really, really important as well. And I think that we need to listen to our teachers. They have a lot of concerns about kids coming back to school.
Yes.
And I think that if we are really serious about educating our kids, which I know all of us are on this phone call, then we need to talk about putting the resources there for them to be educated safely. And there's a number of things that can be done along those lines.
So taking the medical, your professional out of it, you're a parent, does that give you, do you believe a different ability to connect with voters in your district, and it gives you a different perspective on leadership as opposed to someone who doesn't have children? Is it a fair question, or is it just something I've made up?
Yeah, no, I mean, I can understand what you're saying, but it's hard for me to answer that in particular, because I have children. I've had children for 20 years. So I see it. So I only see it through that way. I really can't really get away from the fact that I've got those 4 kids.
Okay. You just told me it was a stupid question without saying it was a stupid question.
No,
that's why you're going to be a great senator.
So let me negotiate that question as best as possible for you. I think that being a mother definitely provides me with the opportunity for diplomacy, because, but larger than that, I think that one of my kids actually pointed out to me recently when we were talking in a group. He's going to be a junior at USC in Columbia, and his group of friends was talking to me, and they're just super excited. They're all new voters, and they're just looking forward to working in phone banking, and they're all from all different parts of the state and want to get involved in things. And one of them was like laughing, has known me for a long time, and said, really, I think you probably have the most stamina of anybody. I think you could just do the whole thing because you stay up for hours at a time, and you can do this. But what my son chimed in and said, well, actually, my mom is a really good listener, but she expects results. So with that, I think that part of being a mom and recognizing that it's really important to be a good listener, and listen to other people's perspectives, because even though they may be your 4 children, my 4 children, they are very different people. And as they grow, they have very different viewpoints, and they come from different life experiences as they go out into the world and come back into your home. And pandemic actually taught us that. We all had to come back and live together for several weeks. And it's important to be a good listener. And I take that into my work with me. And I think that being a parent has made it so, actually made me a better listener in that regard. And I think that moms across the board are natural leaders in their families and in their communities, and are caring and compassionate for sure, but I think have the capacity for listening and collaboration that goes along with that.
So I will add to that I certainly feel as healthcare workers, physician and a nurse, we've been in the business and had the calling of understanding that we want to support our patients, advocate for our patients, and we do that for our families, we do that for our community. So that probably gives us a little extra that we have. But I also think that in this capacity, it helps us understand, and whether we're a parent or non-parent, I'm not sure if that's where it lands, but certainly this is about thinking about where we're going as a state, the future of our children, the future of all little boys and girls that are sitting in classrooms right now, and parents and teachers are deciding how to ensure that they get the best education possible. There's no doubt that we care about that, and so many of our voters and citizens care about that. But we do have to make good decisions. So we have to listen. We have to be open to new ideas. I always say that I believe in crisis is when innovations happen, new things that in disruptions, that kind of innovation that stirs the minds, it stirs our children. We have something in common. My daughter is a rising senior at USC this year. So, this is our opportunity to think about how we can serve our state better in the future for our children. There is no reason why South Carolina shouldn't be in the top 5 of states that's educating students, right? Why shouldn't we do that? And this is our opportunity to jumpstart and be something and do something different. So whether it's a mother, whether it's a healthcare worker, I think it's just because we care. We care, and that's why we jumped into this race. So let's move and do something about it.
So let me get into, take it back to your opponents just a second. Dr. Bingham, you're running against Scott Talley, who a lot of us were not sure that he would make it out of a primary in which someone from the far right was coming after him. You saw him take out the guy who sponsored the bathroom bill. Tell us how we're going to mobilize voters in your district and how we're going to convince women in your district that you are the change and the voice we need during this pandemic.
Yeah, so District 12 is arguably probably one of the heartbeats of our state because of the business corridor that we have coming through here. We have, my district basically borders I-26 going up one side, and then the spine of the district is I-85, that corridor coming through there. We have BMW in there, we have Pelham Hospital in there, the airport is in there, that inland port. So we have a lot of growth and a lot of progress happening up here. And I think that that's really important to remember, is that from the last election, we've had a lot of people join this district. It has grown by leaps and bounds. There's a lot of people that want to see progress. And I think it's important to remember that you want to have somebody who represents you that is transparent, accountable, approachable, and actually is giving you the information you need to know what's happening in your district and how to improve things in your district and how to communicate with them. And I think that during the whole COVID-19 crisis, we have seen that there has been a lot of silence from our leaders, my elected leader including. There's the last blog post he has on there sometime back in the springtime. It wasn't even anything to do about COVID. And so you can't be silent during a crisis like this. You have to reach out. You have to provide resources to your constituents. You have to be responsive to their needs and understand some of the contemporary things that they're going through. And so I think that one of the things that we are really targeting is the new people that have joined our district, as well as making sure that we find the people out there that we know like to vote Democratic and get them out there as well. I think targeted digital advertising is one of the things that we're doing, and making sure that we're doing phone banking and calling to people. We've got a great team of volunteers. We're using social media to our advantage. We're taking every opportunity to do things like this and reach out across the state so that we have people that are backing us up. I think that the South Carolina Democratic Party and the Spartanburg Democratic Party and the Greenville Democratic Party, they have just been rallying behind me and other candidates, and it's so appreciated. I think we need the more and more voters and more volunteers to come out and know that what we're doing out here. Yeah, the Zoom calls are always like the live action
Yes.
theater, right? Because
Yeah.
my wonderful husband just walked in here a second ago and picked up our little dog who was just, wanting to make friends with the UPS guy who was showing up at our house. So yes, it happens. It's no problem. So I appreciate it so much that you've asked that question about our district, because it is a large district and we have a lot going on. And I think that it's important to get everybody out.
Yep.
You have now muted yourself.
Can't hear you.
There we go. I didn't realize that I could not unmute myself when we made it almost an entire episode without Jack barking. So, Dr. Bryant, wait a minute. DrBingham.com is how people can find more about you. We've got about 5 minutes left. Dr. Bryant, you're running against completely opposite of what occurred in the Republican primary in the upstate. You're running against someone who was the far right candidate, who's not supposedly the moderate candidate, who's run for office about 50 times and has not been successful in any of those. Tell us what you are doing that you think connects you to voters in your district, and what we need to do in order to help you get elected as well.
Sure. So let me correct that, Trav. He did run 4 times, but he did win a school board race. But at the time, he was a police officer. And
it counts.
We just talked about honesty and ethics and all those things. So we want to get it on the record correctly, right, Dr. Bingham? So, I think clearly, one of the things that we've recognized here is that voters didn't have a choice in this district for a long time. We've had the same incumbent that retired, but he was in this seat for 13, 15 years. So I think the energy that I have felt around my campaign has been for me just tremendously welcoming, appreciative. Never what I would have expected in running, although I didn't know what to expect in running in the candidacy. So the energy and the excitement of voters and folks who are supporting me, supporting the fact that we can have a healthcare worker, a nurse, and someone who understands healthcare in the Senate has been tremendous. So I would say we're offering and trying to do some of those same things out, and continue to get the message out, continue to share the vision, continue to share that the healthcare and to ensure that everyone has the same access to care should be across the board. And that helps us get back to a strong economy and all those things that we need. Also, my opponent, Dr. Bingham knows the importance of women having the right to have access to some reproductive health. That's something that he's pretty much on the far right of. So I think women and voters will really be excited about my campaign and my candidacy, and we've seen that already. And so we just want to continue to move forward.
And if I'm not mistaken, you and I calculated it's been 30 years since a Democrat ran in this seat. And Dr. Bingham, I'm not sure I can tell you the last time a Democrat ran in that district. But it's DebbieForSenate.com for those of you listening. Go to those websites, learn a little bit more about these two fantastic doctors who are running for office, and contribute. They need money.
Yes,
But at the end, we're coming to a close. So I wanted to give each of you just a few minutes to tell us anything you didn't know and maybe some little tidbit of knowledge that we would never know about either one of you. Dr. Bryant, you're up.
First. Oh, the tidbit of knowledge you would never know. Well, let me start with, I think insanity, we all know what the definition of insanity is, right? Always doing the same thing, expecting something different. So this time, let's do something different and expect something different. So let's elect folks who understand what we need around healthcare issues, that we will increase the tent and bring more people in to have the voice, and someone who will listen to the concerns of voters. So I'm excited to be in this race. I'm very appreciative for the support I get. And so I cannot think of anything that nobody knows about me. So I'm going to pass on that one. Sorry. I'm an open book. That's why I'm just such an open book.
You're going to give me hell for that. I've got a feeling this week.
Oh, well, yeah. Well, I think that it's really great that we are doing these. I think that it's difficult to campaign, from what I've understand, when you are in a pandemic. I wouldn't know the difference because this is my, right? And so we have all become very adept at Zoom meetings, and we've been very adept at doing our best to reach out to people who are excited about the campaign in every way we know possible, and using the different ways of social media. So that's actually been kind of a silver lining, right? Is to have some expertise in an area that we probably didn't, and know how to reach out to people. I think that I would like people on the campaign to know that I'm a determined and very active and hardworking physician and mom, for sure, that's well known. But as a community advocate, I'm looking forward to bringing that kind of energy to the South Carolina Senate. I think that there are conversations that have long been needed to be had inside those Senate halls with the people that are there about the importance of outcomes in education, outcomes for our environment, outcomes in healthcare, and across the board that are really, really important to the people of South Carolina. And those conversations just haven't been had. I think that having a physician in the legislature, as well as other healthcare professionals, will be a wonderful addition to those discussions and a much needed voice. One of the little tidbits, I guess, is in the research in deciding to run to this, I've realized that there has never been a female physician ever in the South Carolina legislature, in the House or the Senate.
Yay.
So that is, it's long overdue, and looking forward to doing that and being that voice, that missing needed voice that's going to be there. But for me personally, one of my interesting tidbits is that I'm also a beekeeper, and I keep bees, and we have had a bounty harvest last year, and this harvest is going along with the way 2020 is going for most people. Not as it's that's how that's gone.
Any idea what's devastating the bees across our country? Is it a mite? Is it a fungus? Is it a parasite?
Yes. So it's called the varroa mite is what affects a lot of people's hives. Yeah.
Vincent Shaheen from over in Kershaw, Camden, also keeps bees as well. But what's the most exciting thing over the next 90 days for each of you? Just a quick answer. Most exciting thing, Dr. Bingham.
The most exciting thing is we are winding down to the 90 days that are coming through for this up to the election. For me, is seeing the growth in this district and all those new progressive people coming out to vote. I am looking forward to that turnout. I'm looking forward to seeing how this district has changed. I think that we had a previous senator here that now that we've had Tally has been, anything would have been a welcome change, but that we will have all those people who are out to vote who now have a democratic choice, which they have not had before, who will represent their interests. So I am very excited to see and actually know how much we have grown and to see all those people come out to vote.
So for me, I think what's exciting is the opportunity to meet with voters, to hear what their opinions, to really kind of listen and have your ears to the grind to know what's going on and to see where they are. And as a first-time candidate, is to learn and to know what I don't know, right? So it's a very exciting time to share in this path, and particularly like what she said, Dr. Bingham said, I've never been a candidate before, so being a candidate during COVID, it's normal. So the normalcy. So let's talk about it's exciting to have the normalcy of running a campaign during a pandemic and to looking forward to success in November.
Well, I want to thank both of you for being on the first Talking with Trav, but DebbieForSenate.com,
Right.
DrBingham.com. And the fascinating thing about these two districts is that you are also changing the psychology of Democrats and independent swing voters who don't realize that the majority of registered voters in both of your districts are women, and that there are significant numbers of non-white voters or people of color who are registered to vote in those districts. And it makes a difference. And also unregistered, some unregistered voters in both of your districts that we're working on as a party. And so thank you both for taking time out of your day. And we will see you on the campaign trail. And for all of you who watched, we hope to see you again with Talking with Trav.
Thank you so much, Trav. Thank you, Dr. Bryant.
Thank you. Nice to meet you, Dr. Bingham. We'll see you. Good luck to you. We'll talk in the State House.
That sounds great.
Yeah. All right.
Bye, y'all.